What is the biggest myth about drug users?
There's so many about us.
I feel like a lot of people put drug users down, like they think that they've got problems or like they're losers or degenerates, but I think, drug users are everyday people. I mean, and it depends also, like, what do you classify as a drug? Like, alcohol's a drug, tobacco's a drug, chocolate's a drug, sugar's a drug, so, I mean, yeah.
I think a lot of people, I think that one of the biggest myths is that people see us as like lacking any agency or like this like totally overcome by addiction, that we're not actually making active decisions in our lives.
These are myths that aren't true.
On the main.
Well, there's good, bad and indifferent in any cohort of people.
Do you regret starting to inject drugs? Oh God, no, I don't.
I don't really regret anything. I regret some of the things that happened as a result of injecting. I've lost a lot of friends along the way. But no.
Okay, it's next question. Do you have a job? Yes.
Good.
I do have a job.
So yes, I do have a job. I've always worked. I'm proud of my work history.
I've always worked. I've worked from the time I was 14. I had some time off when I had my babies, but I've always worked. I was a nurse before I started working in policy and policy development around drug user issues. And usually I have a full-time job and then a full-time volunteer job around prohibition and things like that. So I actually work really hard.
How many times a day do you inject? None of your business. No. Okay, on average 3.
Why do so many drug users have bad teeth?
Why does anybody have bad teeth? This is one of the myths, actually. All real.
I think for a lot of people, whether we're drug users or not, like it can be a big deal, or it can be hard to go to the doctors or the dentist and a bit of a thing you put off, but it can be especially the case for injecting drug users when there's so much discrimination and stigma that we've often experienced like multiple times when we've gone to health services.
How much does your heroin use cost? Okay, just a little bit less than what I earn.
Do people hide their valuables when you come over?
Sometimes. Depends where I'm going. For the most part, no.
I'd like to think that they don't. I mean, the people I tend to visit, by and large, tend to be other people who are drug users, to be honest. No, I don't think people do hide their valuables when I come to their place.
Would you want your children to inject? No, absolutely not. No, it's a painful road to sort of go down, or it can be. It's not the actual injecting that's the issue. It's the things that go along with the lifestyle, I guess. But no.
No, look, I don't think so, only because under prohibition it's such a hard, ugly life that I wouldn't want my children to have to experience that.
Can you travel overseas? Not easily. Not easily, but yes, you can. That's where pharmacotherapy is helpful. I'm about to go overseas at the moment. Hopefully this doesn't come out before I go. But yeah.
Could you stop using drugs? I don't think it's a question of could, or it's more a question of do I want to. And I mean, there's been times where I've used like more drugs than I currently do, and some drugs I use more, and then some I use less, and then it switches. I mean, I don't want to stop, so why should I? I'm not hurting anyone.
Yeah, I don't know. Could. Yeah, I guess I could, like, especially if there were no drugs around, like, it would just be life. I would find whatever path that's there, but like, I enjoy using them, or I use them for a reason, or a multitude of reasons in it. So it's not really a question I think a lot about, like, I'm sure I could, yeah. It's kind of like, could you stop doing whatever thing you like your hobby, or like food that you enjoy eating? Like, it's like, probably most people could, but like, why deprive yourself things you enjoy?
At the end of the day, I actually enjoy taking drugs, and injecting has become a part of my daily life, I guess.